In this episode of Unravelling Autism, we will look at Floortime as a therapy for children with developmental disorders. What is Floortime? Floortime was created in the 1980s by psychiatrists Stanley Greenspan and Serena Wieder. It is based on the Developmental Individual Difference Relationship-Based Model, or DIR. Floortime is designed for autistic children and also for children with other developmental disorders. It is a relationship-based therapy. That is, it is a therapy based on the relationship between the parent and child. The parent gets down on the floor to interact and play with the child. The parent interacts with the child at the child's developmental level. Circles of communication. Together, the parent and child will create circles of communication during play and interaction. For example, the parent holds out a toy and the child responds by reaching for that toy. Or a parent says peekaboo and the child laughs or smiles in response. A circle of communication is any form of action and response, whether verbal or nonverbal, as long as both the parent and child intend to communicate with each other. The parent matches his responses to the child's interests and actions. As the child develops and grows, the parent will engage the child in more complex circles of communication. For example, the child may take a turn to cover his eyes and say peekaboo in a game of peekaboo. Important elements of Floortime. The first step of Floortime is to get the child's attention focused outside their own isolation and to focus on any kind of engagement with another person. The continuous action between the parent and child helps to build the child's joint attention, which is an important precursor in the development of communication. The parent follows the child's lead and enters the games or activities that are chosen by the child. The parent does not instruct, control, or dominate the interaction. Floortime is meant to be enjoyable. It involves enjoyable play and interaction between parent and child. Floortime was developed with very young children in mind and is meant to be initiated as early as possible in childhood. No rewards or reinforcers are used in Floortime. The interaction itself is seen as rewarding to the child. Who can do Floortime? Parents, caregivers, siblings, peers, occupational therapists, speech therapists, psychologists, special education teachers. Parents can also train themselves by attending accredited courses and workshops, and they can also read Dr. Greenspan's book on Floortime called Engaging Autism. Where and when can Floortime be done? It can be done at home, in any environment where interaction and play is possible, example a garden, the park, or the playground. Floortime can form part of a child's day-to-day life. It should be done for as long as 2 to 5 hours a day, and it may involve an initial assessment by a professional. Floortime can also happen in a school setting, at playdates, and during other therapies such as speech or occupational therapy. Milestones. According to DIR, parents can help their child to reach certain milestones that are identified by the founder of the program, Dr. Greenspan. These milestones are as follows: self-regulation and interest in the world, intimacy or engagement in relationships, two-way communication, complex communication, emotional ideas, and emotional thinking. Developmental milestones. Floortime claims to promote development in several areas through its approach of enjoyable engagement. These developmental milestones are sensory development, cognitive development, social development, motor skills, emotional and cognitive development, communication. Pros and cons of Floortime. Greenspan explicitly warns against repetitive routines, but for learners whose strengths lie in learning from routine, Floortime may become frustrating or confusing. Interactions that are routinely unplanned and spontaneous could potentially cause greater levels of problem behavior, anxiety, or aggression. Children who stubbornly refuse to engage or to allow another person into their world may become more resistant to change. They may withdraw and interact less rather than more. Children who take the lead in therapy may struggle to adapt to a structured environment such as school, where they are called upon to follow routine and instructions. Floor time is more suitable for small children, but will be less appropriate to help older children. Floor time does not give clear explanations or pathways as to exactly how developmental milestones are to be achieved, but it does affirm their importance. If a child acts in ways that are not functional or appropriate, and circles of communication follow this lead, there is less opportunity for a therapist or parent to shape appropriate behavior in the child. Behavioral therapies such as ABA have clearly defined and measurable goals. Developmental therapies such as floor time have goals such as playfulness, creativity, and emotional connection, which are difficult to measure. Floor time could encourage a great deal of joint attention and social interaction, which would help a child to learn and develop. Floor time can strengthen bonds between a child and his parents or caregivers. Floor time does not include a specific program to address communication disabilities in stages, although the concept of circles of communication does continually address the need for communication. For this reason, the therapy may need to be paired with other therapies, for example, speech therapy. Reviews and research done on floor time. In 2007, a pilot study by independent researchers showed benefits for children who practiced floor time. Two 2011 studies, one in Thailand, another in Canada, supported floor time as improving emotional development and reducing autism's core symptoms. My personal experience. When we considered what therapy to use, we opted for a program of verbal behavior, which is a form of ABA. We did not specifically consider floor time at the time, as we were not exposed to information about it. Our daughter was already in school, and ABA seemed to be aligned to the curriculum and skills required of a school environment. Natural environment teaching was part of our program, and it involved a lot of spontaneous play, which included the closing of thousands of circles of communication. So I think that it is incorrect to assume that various forms of ABA do not include spontaneous play and circles of communication as those that are found in floor time. Thank you for listening. In my next episode, I will be looking at the communication delays and deficits found within autism.